In this video, we discuss key steps to optimize visualization during silicone oil removal surgery. In this case, shared by Dr. Yassine Malek from Agadir, Morocco, a patient with a history of multiple surgeries for a closed funnel retinal detachment underwent a new procedure to remove silicone oil. At the start of the case, a 3-piece intraocular lens is decentered inferiorly, with anterior synechii and opacification of the posterior capsular complex behind the IOL. The surgeon begins by performing synechialysis and repositioning the IOL in the ciliary sulcus. Next, he creates an opening in the posterior capsule behind the IOL using a 30-gauge needle and injects a small amount of viscoelastic. This helps prevent silicone oil from migrating into the anterior chamber, stabilizes the IOL position, and maintains a clear view of the posterior segment. The posterior capsulotomy is then enlarged with 25-gauge scissors to an adequate size. With this, he achieves sufficient visualization to complete the thorough removal of silicone oil from the vitreous cavity in a complex retinal detachment scenario. In addition, the surgeon performs an inferior iridectomy using the vitrector. Note that at this point he switches the infusion to the anterior chamber in order to stabilize the anterior segment and minimize bleeding. Even so, endodiathermy is required to control iris hemorrhage and preserve visualization. At the end, he is able to inspect the posterior segment with excellent visualization and concludes the case with a fluid air exchange.